So friends, on behalf of My Retired Life Foundation and also on behalf of the All India Senior Citizen Confederation Cultural Committee, we extend a very hearty welcome to all of you for this very exciting program that is in store for us. Friends, we have been passing through great days. Yesterday we have been International Day for the Older People. Today we have the birthday of the two of the greatest sons of Mother India, Mahatma Gandhi and Lal Bahadur Shastri. And we are in for the 10 days of Navratri and so on and so forth. So we are actually in a very exciting time now. And during this particular topic, day we thought that we will have an exciting session on a very interesting topic, and that's the elder care, particularly for the perspective of the eye care for the elderly. And to talk on this particular topic, we have with us a very renowned personality, Dr. Manali Hazarika, and she has been arranged through the good initiative of Padmakini Madam. Padmakini Madam, may I request you to kindly take it forward henceforth? Please unmute yourself, Madam.
Yeah, thank you, Sengupta, Dr. Sengupta, sir. I welcome all the viewers from ISKCON, from Manipal Mahila Samaj and our own MRL. It is a beautiful program coordinated by Dr. Sengupta ji and we all. It is my pleasure to welcome a sweet personality, our own Dr. Manali Hazarika Singh from Manipal. Dr. Manali is a senior consultant in cornea refractive and anterior segment services at Kasturba Hospital, Manipal, Udupi, Karnataka. Currently associate professor in tertiary center of a university teaching hospital named Kasturba Medical College, Manipal, a unit of Manipal Academy of Higher Education, MAHE. It's called MAHE. Dr. Manali is also the executive director of Kasturba Hospital Eye Bank, which is the largest eye bank in coastal Karnataka that enables eye donations and corneal transplants in the region. 14 years of experience in clinical ophthalmology, Dr. Manali is proficient in a diverse range of corneal transplants, cataract surgeries, refractive surgeries, as well as ocular surface procedures. Her areas of clinical expertise include diagnosis and management of advanced corneal diseases such as keratitis, ectasias, ocular surface squamous neoplasias, ocular surface chemical and internal burns, corneocerebral tears, immunological diseases like Stevens-Johnson syndrome, all these many kinds of, ocular allergies and dry eye diseases. She has expertise in corneal transplantation of various kinds, artificial corneal transplantation, Boston type, mucous membrane grafting, tenons, all these such various kinds of surgery she has expertise. Dr. Manali is a recipient of several awards, including Distinguished Alumni Award 2021 from MAHE University and a Certificate of Merit from All India Ophthalmological Society Conference for her paper titled Drug Reservoir Function of Voriconazole Impregnated Human Amniotic Membrane. She has been awarded with various grants for her outstanding research work in the field of ocular surface and is the winner of the research grant of rupees 41 lakhs plus, which was awarded by Scheme of Promotion of Academic and Research Collaboration, IIT Kharagpur on 1st September 2023. Congratulations. For her international collaborative research study titled Evaluation of the Bacterial Ocular Surface Microbiome in the Neonates. Dr. Manali actively teaches and guides undergraduates MBBS degree, postgraduates ophthalmology, and PhD students. She is an active member of the American Academy of Ophthalmology, International Keratoconus Academy, the Cornea Society of India, and the All India Ophthalmology Society, life member of Karnataka State Ophthalmic Society and Udupi District Ophthalmic Society. Dr. Manali is a beautiful personality, very sweet personality. I have seen her, treating the rural-based, rural interior villages, women especially, how she treats them. I have seen my own eyes in the camps. She's a beautiful personality, and she is blessed with 2 children, daughter Ishana, 12 years old, and son Krishna. Husband, Dr. Rohit, is HOD in the Department of ENT, Kasturba Medical Hospital, Manipal. Here I present Dr. Manali, and also I want to tell you all that it is a coincidence that today is Gandhi Jayanti, and we are doing some, program from Kasturba, which is connected to Gandhiji, Kasturba Hospital, Manipal, Mahe. Some connection is there, maybe coincidence. So thank you very much. Here, over to Dr. Manali. Over to Dr. Manali.
Thank you so much, Padma ma'am, for this beautiful and kind introduction and such beautiful words. I also like to thank Dr. Sen Gupta sir for giving me this opportunity. And at the outset, I want to give my sincere thanks to my retired Life Foundation, AC and as committee of All India Senior Citizens Confederation for giving me this opportunity to talk to all of you on a topic which is very close to my heart, which is the eye donation awareness. Actually, if I may share my screen.
You can share.
Madam, is it, sir, is it visible?
It's visible.
Yes, it is visible.
Okay. So, Madam has also asked me to speak a little bit about the eye care in the elderly population. So I would like to start off with that topic because I know that this is something which is very important in this age group, and how to take care of your eyes so that you can have a better quality of life. So let's start with eye care advice for senior citizens. So the first advice I would like to give is to annually go for a eye checkup. This is because there are lots of conditions which may be which may silently rob you of your eyesight, and you may not even come to know. You may feel that I can see everything, but that may not be so, because these are chronic and slowly progressive conditions which creep over the years. And then at the end point, suddenly the patient will get the symptom of reduction in vision. So an annual checkup is a must. And you know that in the elderly age group, the common eye conditions are cataract, glaucoma, macular degeneration, diabetic and hypertensive retinopathy, and dry eye disease. Now, in this first picture, if you can see, this is the white color structure, which happens to be a opacification of the lens. And this is manifested as a decrease in vision or blurring of vision. And this condition is known as a cataract. But remember that you need not wait for it to become so white, so pearly white, or so much, opacified to get a cataract surgery done or to even get an eye checkup done. Even in the early stages, if you can go and get yourself checked up annually, you can prevent it from going into such an advanced cataract stage. Second is the macular degeneration. So as you can see here, these white structures are drusens, and these are pigment clumpings which lead to an atrophy of the visual area. Now this area is known as the fovea, and sometimes there may even be a blood clot like this. Is my arrow visible, ma'am? The white arrow is visible?
Yes.
Okay.
Yes, please.
Yes, dear.
So this area is actually known as the fovea. Fovea is responsible for the sharpest part of the vision. And here, if you see a presence of a hemorrhage or a blood clot, it can hamper your vision vastly. And these are again known as age-related macular degenerations, which can hamper the sharp foveal vision. Next is glaucoma. Here in this picture, we can see a healthy eye with a normal optic nerve head, wherein you can see that the yellow part is very small and the red part, which is the healthy part, is very large. This is how a normal healthy eye and optic nerve looks like. But in a patient who has glaucoma or a rise in the intraocular pressure, we can see that slowly, the eye, which is having glaucomatous cupping, becomes more of yellow in color and less of red in color. So you can see that generally speaking, there is an atrophy of the optic nerve head with the death of the nerve cells, and the healthy part is very faint and you can see a thin frill of reddish area, but mostly it is a dead optic disc. So these are all irreversible changes. So the glaucoma, then certain hemorrhages, certain atrophies, these are all irreversible changes. And therefore, an annual checkup can help you to identify it earlier on and prevent it from going to such an advanced stage. Cataract, on the other hand, is more of a reversible cause of blindness, and a cataract surgery can definitely bring back the vision of the patient. Nevertheless, I want to again reiterate the importance of regular eye checkups. Definitely on an annual basis, it is a must. Now, you may wonder, okay, how can I recognize that I am having some problem? So if you see a patient who is normally viewing this scenario, the colors are all appearing very bright. The contrast between the different trees or the structures is very clear. Whereas a patient who develops cataract can still see the sky, the grass, and the trees, but you can see that the contrast will be very reduced. Even the colors will appear dimmer. So it will never be that the patient will say, I cannot see. They may be able to see in the earlier stages, but the clarity of vision with a cataractous eye will definitely be less. So first is report to a doctor if you see any change in your vision. So the TV, the serials which you're watching, the colors may look more faded. Although you may be able to recognize your favorite TV characters, still you can see that there will be slight change in your vision, which you need to report to a doctor. So blurriness, double vision, presence of seeing double, or even a sudden loss of vision. For example, this picture, you can see that this is a patient who has retinal detachment. And if you see that in the field of view, the superior area appears very dark, whereas the inferior area or the lower portion where the patient is viewing some map, that is visible. But 1/2 of the visual field is dark. So this sudden loss of vision can be a indicator for a retinal detachment. So in such cases also, you have to definitely report to an eye doctor. Next, imagine this patient has glaucoma. So whenever there is glaucoma, the patient will have very good central vision. However, the peripheral field of vision will be largely diminished. So it is never that the patient cannot see. They can see centrally everything clearly. Even you can see the contrast is also pretty good. But look at the peripheral field of vision. This view of a beach, of a coconut tree, of water, sky, everything in the central part is clear to the patient, but the entire image is blurred from the periphery wise. So this is how the symptom of glaucoma will appear. So recognize these symptoms, recognize these signs, which are warning signs for more severe conditions, and report to your doctor immediately and earlier on to prevent further damage. Next thing you have to take care of is nutrition. Eat a healthy, balanced diet. Focus on foods which are rich in vitamin C and E, omega-3 fatty acids, lutein, and zeaxanthin. These are micronutrients which are available in certain capsules, which will help you to enrich the levels of these micronutrients in your blood. Also, leafy greens, carrots, fish, and citrus fruits are great choices to be added in your diet. Next thing is stay hydrated. Drink plenty of fluids and water to keep your eyes moist and healthy. So you can see that one more thing that you need to take care of is controlling of your sugars and your BP problem. This is a normal retina. You can see that this is the optic nerve head, this is the cup, and this is a beautiful fovea and the macular area. All the blood vessels are very beautiful. You can see even the pink healthy optic disc is nice, but a patient with diabetes which is uncontrolled will have all kinds of bleeding and hemorrhage in the retina, cotton wool spots, hard exudates. All these conditions will definitely hamper the vision, and just by taking a good healthy nutrition, a diet with good nutrition, a well-balanced diet with good sugar control, taking your medications on time, BP and sugar medications, this can prevent a picture like this. Now, the next thing which we tend to neglect is sun protection. So wear sunglasses, especially those which block 100% of the UVA and UVB rays to protect your eyes from sun damage. There are many conditions such as pterygiums. As you can see here, there is a wing-shaped fold of conjunctiva, which is progressing from the white part of the eye to the black part of the eye and obscuring the vision by covering the central part of the eye. So definitely, this is UV rays induced condition called pterygium, and wearing a sunglass or a hat or a visor which can protect you from sunlight can prevent these kind of conditions. Additionally, remember that the lid skin is prone to have some tumors. So there are some tumors which can also occur due to UV ray exposure. So try to protect your skin around the eyelid also by wearing sunglasses, wearing sunscreen, and hats and visors. Nowadays, we are very much used to using all kinds of devices, not just the TV, but our mobile smartphones, our iPads, and all kinds of computer screens. So remember that screen time management is very important. Adjust your screen setting so that you don't strain to read the small letters. Increase your text size, and also improve the contrast on your devices, making it more brighter to reduce the eye strain. Use blue light filters if available. Take breaks in between your screen time. The famous rule is 20-20-20. What does this mean? Every 20 seconds, take a break for a period of 20 minutes by looking at an object 20 feet away. So this break will give your eyes some kind of respite from being exposed to the screen continuously. Also, use bright and even lighting for your reading tasks in order to reduce strain. At the same time, use anti-glare screens on devices and avoid the light from being directly, avoid the bright light from being directly overhead from your screen, and thereby you need to reduce the glare. So sometimes the light can be too bright or too dim. So make sure that it is very evenly lit room, and the light should not be directly overhead in order to prevent the glares. Next thing is lifestyle choices. We know that smoking is linked to several diseases such as cancers. Even in the eye, you can see cataract and macular degeneration are the common conditions which cause a lot of debilitating eye problems. So quit smoking if you're a smoker. Stay active. A regular physical activity promotes overall health, including eye health. So aim for at least 150 minutes of moderate exercise each week. Keep diabetes, high blood pressure, and other chronic conditions such as arthritis in check by regularly taking medications. And if you have dry eye, use topical lubricants on a regular basis. Also, certain cardiac or certain psychiatric medications can have eye-related side effects. So we need to monitor these medications for side effects. Even certain arthritis drugs such as HCQs do have, and anti-TB medications also do have certain eye side effects. So discuss the eye-related side effects of your medications with your doctor. So I hope that with this, it is clear about all the care that the elderly need to take in terms of their eye health. If there are any questions, I'll be happy to answer.
I want to ask, doctor.
Yes, ma'am.
Yeah, I got my yeah, suddenly I forgot. The cataract surgery done in February. But
Okay.
what happened? No, sometimes I'm getting that itching. So is it okay to do just like that?
So, ma'am, remember cataract surgery can cause some amount of dry eye. And remember that the age itself can cause a age-related dry eye disease. So cataract surgery can in fact aggravate it. And one of the symptoms of dry eye is itching, grittiness, these kind of symptoms will come. So it's very important to be on lubricating eye drops. That will prevent your itching and all.
I have the Cystine eye drops. Can I put that? For
you must put,
ma'am. I can use that day.
It is like a multivitamin. So lifelong.
Okay. Got it. And another thing, I have a white line in my eyeball. No. So what is that about?
That is age related, ma'am. So just like the hair will start becoming gray, like that the corneal periphery will become gray in color.
Yes, white color. Yeah, correct.
Yes, it's a part of aging, ma'am. It's a sign of aging. Nothing to worry. But you should get your cholesterol levels checked.
Yes, I'll do that. Yeah, thank you.
I'm Miruna, madam. I'm asking you one question.
Yes, ma'am.
I'm already acute patient of AMD.
Okay.
Macular degeneration.
Yes.
So very recently, 2 things have been added to my house. So whether it is correct. One is a very big TV my husband has bought, 75 inches. That is QLED, which I'm watching at the distance of around 12 feet. Is that QLED? It is seems to be like not harming eyes. Is it correct?
Yes, ma'am. What you need to understand is about your condition. I must say that this is a chronic condition, and the TV and the devices, in fact, a larger screen is better for you because you will be straining less and it will be more clearer for you because already the macula is weak. So you will not be able to view the finer things and smaller things easily. So bigger screen is always better. And QLED is supposed to be safe. You can even put it on the blue light filter mode. That the one TV you're referring to has got a certain setting which you can go there and put blue light filter and anti-glare mode, and that will protect your eyes, that will protect your macula and your macular degeneration. So big screen is better, ma'am, for you.
Thank you. Second thing is, in kitchen, very high power LED light is put, that is 40 watt. because I'm not able to see things with normal eye.
Yes, yes, yes.
That you said the highlight should not be there, but from top, when I'm cutting any vegetable, fruit, anything, cooking, so is that okay?
No, the first thing is that because of the nature of the macular degeneration, in fact, you will need to have brighter light than regular to see things. So it
right.
actually, the glare, what I am referring to is the bright light from the overhead, bright light falling on your screen of your iPad or your smartphone and then reflecting back. I'm talking about that glare.
Okay, I got
So
it.
this will not affect you. This is in fact good for you. You need brighter lights, bigger screens, bigger font. Even in your smartphone, you have to change the setting to bigger text size.
Yeah, to brighter
Yes,
size.
yes, bigger text size and brighter. Yes, ma'am.
Yes, bigger font. Thank you very
Yes.
much. Thank
Thank
you
you.
so
Thank
much.
you.
I got two questions.
Yes, ma'am. Yes, ma'am.
Number one question: these age-related macular degenerations, are they genetic diseases?
There are different varieties, ma'am. So one variety is age-related, which comes with age. But yeah, there is some studies which are going on regarding that. My retina colleagues will be able to answer better about it.
And fine. And my second question is, I am also like the previously my colleague Miruna Makar also same patient like me, age-related macular degenerations. Mine is AWMD case. And I almost lost 99% central vision. My question is there any chance that my peripheral vision also will slowly decrease?
Ma'am, do you have a cataract?
No, cataract is very beginning, maybe, I think.
Yeah,
But
as your
cataract is not my problem.
progresses-
My cataract is not my problem. My present problem is 98% almost central vision lost. And
Yeah,
my
ma'am.
question is will it affect the peripheral vision also later?
So if the cataract starts to progress, which it will progress as your age progresses, at that point of time, you may feel that your peripheral vision is also reducing because the cataract can also, yes, cataract can add on to your vision problem.
Okay. That means these two, they don't have any connection in between them. Central and peripheral vision.
The peripheral vision will start reducing once the cataract starts progressing.
Okay.
At
Mine
that
is
time.
almost central vision almost lost. So that's it. Thank you very much for the clarification.
Take care, ma'am. Take care.
Okay, thank you very much.
Yeah.
I have a question, madam.
Yes, sir. Yes, sir.
In 2016-17, I got both my eyes cataract cleared. I was high myopic with the cylinder very high, but the left eye, which was totally, with -14 and cylinder -4.5, that got cleared. But the right eye is still having 1.5 or 1 cylinder and only about one number, maximum. The angle, because I have to wear these glasses always, I have this D lens or the round lens. So I use it. But certain times when I'm driving or that, I have to use another lens to overcome the surface area, while driving, the distance and the dashboard of the screen where the car driving, So is it okay, or is it advisable to use a gradual lens, But gradual
Progressive you are referring to.
progressive, yes.
Yeah.
That is one thing. And
So,
second thing is, while seeing a movie or something at a cinema house, my eyes start watering. So is it a strain or is it due to the...
Yes, sir. So this is again very good question. First question I will answer. So you have undergone cataract surgery?
Yes.
Both eyes.
Yeah.
So
And as
after,
single lens only I have put for the distance. That's
yeah. So you have put. Now the thing is, because you are used to using bifocals for so long, now if you change over to progressive, you may face some adjustment difficulties. So even up to 1 month or 3 months, sometimes people take to get adjusted to progressive, and some people never. So if you are used to this bifocal, generally we don't shift to progressive.
okay.
Okay.
And
Number two,
Yes. Continue. Sorry.
If you are using more of, say, computer work, so that is intermediate vision, and you
Yes.
feel difficulty with your present glasses, we can give you another glass known as the working distance glass. So only while using your computer, that is intermediate distance, you can use that. So that will have intermediate distance and the near vision distance. It will not have your distance. But what will happen is you will have to keep on changing. Like you said, you use a separate pair of glasses for driving.
Yes, I have four glasses because I use a lot of the mobile phone as a photographic addict. So my daughter always shouts at me. So many times I will shut everything and just close my eyes and listen to the music or whatever. Certain times what happens is I'll be watching, that means not one episode, 6 to 7 episodes at one go. That means 4 hours. So I don't remember. That's why I stop the TV also, switch it off rather than continue watching. Because that feeling is coming, one more. So I forget the time constraint. So that's why I have restricted to 2 glasses where I can read and write, where I use a proper distance and light effect. Whereas the other side, I have to use less light for seeing the TV. Is it okay for seeing the TV a little less light,
Yeah. Yes, that I was referring to less glare. So you're changing the setting to reduce the glare. Why you are
Yes.
getting watering is the same reason, sir. The 20-20-20 rule has to be followed. Every 20 minutes, look away from the screen, blink 20 times and look at something which is 20 feet away. What happens is when we are staring at a screen, we forget that, like, our mind is involved in the content. We forget to blink. When we forget to blink, our tears roll down. Generally, tears will just circulate all around our eyes because we are, blinking 15 times every minute. That is a normal blink reflex. But when we stare at a screen, we forget to blink. So that is where the 20-20 rule will help you to prevent the water from coming out of your eyes. And you can even supplement with some lubricant like Systane or any teardrops, any eye drops to give you more lubrication and help you.
Thank you. Last word. When you see a 3D movie, I can't stand that using those dark glasses, and it is so stupid that I come out of it and I say I'll see the normal movie with a normal lens rather than seeing this 3D business, because that causes a headache here.
Headache. So that, yeah, you are wearing it on top of your glasses, na?
Yeah,
or you're
but
directly using it.
No, I wear on top of my glasses, but it doesn't match because what has happened, people are very often using plastic lens and I use glass lens, and glass lens has to clarity and the angle or axis on only in the one eye. The other eye is okay. So sometimes I'm able to see, sometimes not able to recognize. That's why I prefer not to see 3D movies only. Because
3D movies can be challenging. Yeah, definitely I understand.
So
maybe
it's not advisable for my case, but I just wanted to share, and thank you so much, doctor, for the lovely explanation.
Okay, doctor.
No, sir,
Dr.
don't.
Manali,
Yeah, you can use
one,
single vision
Madam
glasses.
Hema has a question.
Okay.
No, I want to
Thank
tell
you, madam.
Naveen
There are
sir
questions
that.
on chat box. Can you, Padmaji, read it for her, please?
Okay.
I wanted to tell Naveen sir that he need not miss out on watching 3D movies. He can use his single vision glass which he uses for driving, and on top of that he can wear the 3D goggles. Otherwise, like regular specs with the bifocal, he'll have difficulty. Yeah, continue, ma'am.
Okay.
I think somebody
There is
raised their hand.
Hello, Dr. Manali. There is a question asking post-cataract implant surgery, after how many months face steaming can be done?
Face steaming.
Yeah. Question from doctor. Question.
Yeah. So if the surgery is a phaco surgery, after 15 days, patient can be completely normal and go ahead with all the activities, such as putting water on the face or steaming your face, facial, head bath, etc. So generally, phaco surgery the incision size is only 2.2 millimeter. So that's a very small incision. It heals within 15 days. So you are safe to go for your routine after 15 days. But you should put the eye drops properly.
Okay, one more question is, what is ocular scleritis? Hello?
Not able to understand the question.
What is ocular? SCIERITIS. Sclerosis. Are you understanding?
No, I didn't understand.
Okay. Next question is, does all cases of IOP lead to glaucoma?
Not all cases. We do have certain falsely high patients, with falsely high readings, which can be due to corneal thickness, etc. So generally, we take 2-3 criteria to judge whether the patient has glaucoma or not. Just a high pressure in the eye is not a diagnosis for glaucoma.
Okay.
Hello, madam.
Doctor,
I want to ask you a
doctor,
question.
doctor,
Yeah,
Ma'am,
I have a
Swati, ma'am.
question.
Yeah, sir.
Acha, doctor, the technology has advanced so much. Everything we do needs more of screen time.
Yes.
Everything is online. Everything is on. And even reading Kindle users, as you go in an aircraft, read a book on the Kindle, you have to use a lot of time, screen time. But what you say, that the only remedy seems to be 20-20-20. But is any research going on so that even when people read and use more time, their eyes or the quality of vision is not affected? It is just a general question. I guess it is applicable to everybody. Thank you, doctor.
Yes, sir. Not just 2020, we also discussed, sir, about blue light filters. We discussed about changing your font size. We discussed about reducing the glare also. So there are various settings in your Kindle which you can do to help you to reduce your eye strain. But essentially, if you keep staring at a screen, even movie theater, you stare at the screen or the, so that can definitely put a strain on your eyes. And what they say is the bigger the screen, the lesser strain. So instead of maybe looking at smaller screens like smartphone, try to use maybe laptop, desktop. And if you want to see some serial, instead of using desktop, try to see on the TV screen. So that's what they say, bigger screens, the better. Blue light filter, reduce your glare, increase your font size, along with 20-20-20.
Yeah.
Okay.
Ma'am, can I ask you a question?
Dr. Manali, there is one question about a child gets a small boil-like thing on the eyelid off and on. How can one prevent it, please? It does not get pus. What is that boil?
Yeah, so first of all, children, when they present with this kind of a feature, we assume that there is hand-eye contact. So hand-eye contact can happen. One is like the child cannot see the board. So child will start rubbing the eyes. So maybe there is an underlying refractive error, number one. So child has to go for eye checkup to rule out any eye power. Number two, child may have allergy. So we have to rule out any allergy. It could be allergy, eye disease due to pollen, dust mite, etc. So keep the house clean. Use a face wash. Be hygienic. Hand washing technique. After touching something, then going and rubbing the eyes is not very hygienic. So maintain facial hygiene, hand hygiene. Check up, go for an eye checkup with the doctor. And if it is, infectious, then we have to give an antibiotic to the eye, like an eye ointment, etc. And if glasses, if power is there, then glasses will be given to prevent.
One more question. How long can we wear contact lenses?
Contact lenses of 8 hours per day. Yeah, Swati ma'am has a question, I think.
Yeah, her question only is okay. Swati ma'am.
I was asking. I was asking about this contact lenses because I'm wearing it for a very long time now. So can I continue? I'm already 65 now, so I have no problem. But
yeah, see, contact lenses, ma'am, it definitely, if you are maintaining it well, cleaning it properly, using it 8 hours a day, not putting water into your eyes, then definitely you can continue for distance vision. Are you using bifocal contact lenses?
No.
Monofocal, okay.
Monofocal. And another thing, my number is quite high. Like it is, I think, with the lenses, I also wear an additional for reading, 2.5. So 8 is the maximum you get in the lens. Plus 2.5 I require for reading. So can this, and I have got plus, like hypermetropia, no, they call it. Plus, it's not a myopia, it's not myopia. So can it be corrected by a lens?
Yes. Ma'am, how old are you? May I know that?
65.
Ma'am, then you can definitely go for the cataract surgery. You will not need any contact lenses or anything. Directly, the lens will be inserted into your eye during cataract surgery. And you can be free from contact lenses or even glasses.
Okay, so the plus number also goes off.
Every power will be removed, ma'am. We put a multifocal lens in your eyes. You'll be free from all the jhamelas of glasses, contact lenses. Nothing. Directly we put the lens surgically into your eye through the cataract surgery.
I'm very scared. I don't know. I've checked my eyes. There is no cataract till now, but
by the time you are 65, some amount of, see, it may not be very significant cataract, but there may be early cataract. Even some lens changes can be definitely there at your age group. It may not be fully white or opacified, but definitely the lens will harden. So for your case, ma'am, no need of any tension. It's a very safe surgery. Phacoemulsification with multifocal lens. You will be very happy with the results. You will not need additional glasses or contact lenses.
Okay. What is it called?
Multifocal lenses implanted into your eye during phacoemulsification surgery, which is a cataract surgery.
Okay. Thank you, ma'am.
Okay, Dr. Manali.
Uday Acharya's question, please.
Okay. There is a question by Krishna Veni madam. Can eye donation be done post-cataract or by a person with IOP issue?
Yes, ma'am. And we'll be coming to that next. If I may start my presentation on this topic.
Yes.
Okay.
Ma'am, just one single question for Uday Acharya, who right now is having swelling of the right retina. So is it, how can it be contained? What was the cause? He's on some eye drops now, so he doesn't have sugar. So what would be the reason for this and how can it be contained? Thank you.
So did the patient undergo any cataract surgery or any surgery in the eye? What is the duration of the retinal swelling? So there's a lot of questions we need to answer in terms of, is there an inflammation in the eye? Is there a surgery that the patient has undergone? What is the location of the inflammation? Is the patient hypertensive?
No, ma'am. So no hypertension, cataract 10 years back, and retinal, right eye retinal swelling, which is recent to about 2 weeks.
Yeah, so we need to see the location of the retinal swelling. Is it the macula, as I showed, the central part, or is it the peripheral part? Is it near the vessel? Is there any blood clot? Is there any hemorrhage? There's a lot of things that might need consideration before giving an opinion. I think you should see a retina specialist for this. I'm actually a cornea specialist, and maybe, the answer may be with the further evaluations and scans may give us a better answer.
Yes, doctor. Thank you so much. Thank you.
So I will like to start with my presentation, since many people have asked about corneal donation. I would like to just start by telling everyone about what is the problem and what is this corneal blindness. So blindness is defined as presenting a visual acuity of less than 3 meters in the best seeing eye. And blindness from corneal disease is a major ophthalmic public health problem in India. In fact, there are 1.2 million corneal blind persons in India today. And to this, 25 to 30,000 people with corneal blindness are added every year. And in fact, the only way to treat this corneal blindness is through corneal transplantation. In India, we need 270,000 donor eyes to perform 1 lakh corneal transplants per year to tackle the blindness which is due to corneal diseases. Here we have a patient who had undergone a cataract surgery which had failed, and there was a injury to the cornea during the cataract surgery, unfortunately. And this patient had a vision which was just hand movements. In the sense, the patient could not even perceive 1 meter. Patient could only see the movement of the hand in front of the eye. And this patient from hand movement vision got transformed into a patient who was able to see up to 24 meters following the cataracts, following the corneal transplant surgery. So here we have replaced all the 5 layers of the cornea. In fact, cornea became white in color, and you can see how it is beautiful and transparent with all the sutures, which is known as a penetrating keratoplasty, and the entire cornea was replaced. Inside, you can see that this is a previous surgery, cataract surgery done with the previous doctor, and there was a lens here and there's some iris atrophy here. But by and large, if you see, we have removed the opacification and rehabilitated this patient to 24 meters from hand movement vision. So what is this corneal transplantation? Is the whole eye transplanted? So somebody asked, if I have a glaucoma problem or a pressure in my eye, or if I have undergone cataract surgery, will I be benefited from a corneal transplant, or can I donate my eyes? So to understand that, let's know what is this corneal transplantation. So this is in fact the front part of the eye. This is known as the cornea. It is the most transparent structure. And behind that is the lens, this one, which we were saying that there can be cataract, etc. Behind that is the vitreous humor, where we say that the pressure of the eye is very high. Aqueous humor here and vitreous humor here. And here is the retina and the optic nerve. So this is the back of the eye. So remember that any disease which affects the optic nerve, which affects the retina, which affects the vitreous humor, which affects the cataract, which affects the lens, which affects the aqueous humor, all these things are immaterial to corneal transplantation, because cornea, that is the front part of the eye, is the only part which is taken from the eye, and only that part is transplanted to the person for rehabilitation and to treat the corneal blindness. The other structures are not touched or not taken for corneal transplantation. In having said that, if a patient is having a corneal blindness wherein the cornea becomes white and the patient has a retinal detachment, so 2 things, if they have a problem in the front of the eye as well as back of the eye, in such patients, even though we do a corneal transplantation, they will not get vision. Because for corneal transplantation to be successful, the rest of the structures should be normal. So this is what we have to understand. So we have to understand that corneal blindness is only when the cornea is affected and rest of the structures are normal. And to rehabilitate these patients, only the cornea has to be transplanted, not the other structures. Now, sclera is the white part of the eye, this part here, as you can see. Now, for sclera, it is only used sometimes to create a patch graft wherein the sclera has melted. So if the disease process spreads from the cornea to the sclera, then to replace that scleral melt or to patch the eye, we use a scleral patch graft. But this is not for vision purposes. For vision, it is only cornea which is used, and it is the surgery is called as corneal transplantation or keratoplasty. And it is the frontmost part of the eye, which is the most transparent part of the eye. So despite having a disease in the back of the eye, you can donate your cornea. But if you are a recipient of a corneal transplant, remember the back of the eye should be normal. This is one thing I want to clarify. So we can not just give them vision, we can in fact renew their hope and transform their lives. Because this is a patient who had undergone an infection following a injury in the agricultural sector, wherein a paddy husk had entered into the eye and created a fungal infection in the eye. So the cornea was by and large clear peripherally, but if you see the central part of the area where the vision is located, that area had become completely opacified with some pigmentation. This patient had lost vision and the patient was very upset and even tried to commit suicide. because this patient had to put the drops hourly and was really upset with the entire treatment which was taking place, because it was a fungal infection and it took her almost 4-5 months to get cured from the infection itself. And once the infection got cured and the patient had to use multiple types of eye drops in a dosage which was in an hourly manner, like 12 times a day, 18 times a day, patient was literally fed up and tried to commit suicide. But luckily they came to us and we were able to transplant the entire opacification, like we cut out the diseased cornea and we transplanted it with a clear cornea and put so many sutures here. It's a penetrating keratoplasty, full thickness replacement was done. And the patient is so happy. Patient is able to go back to work. Patient's family is happy because, economy. Patient was not earning anything and using all these costly medications. It was taking a toll on the entire family. So one corneal transplant can not only give vision, it can renew the hope in terms of the life of the patient and transform their entire family's life as well. So this is the impact that one corneal transplantation can have. So what are the causes of corneal blindness? So there was a study, which is the core study. And here they found that the prevalence was higher in the elderly and the illiterates. Also, the common causes of these opacities was pterygium, traumas, and infections in the eye. Also post-surgery, there was a bullous keratopathy, which I showed you the first picture. The patient had undergone a cataract surgery and it was not successful. So 46% of people in India are blind due to post-surgical bullous keratopathy. The next 23% of the people are due to some kind of congenital diseases or some degenerations in the eye. But if you see in the South India, most of the cases, that is 59% of the cases were due to infections in the eye and 23% of the cases were due to some trauma. So here you can see there is a ring-shaped infiltrate. There is a pus in the eye. The whole eye is red, inflamed and infected. Now this patient actually underwent a corneal transplant during the COVID phase. And unfortunately, due to the lockdown, this patient never came back for a checkup or a follow-up. And what ensued was a picture as gory as this. So this is a patient who had the transplant. These are all the sutures that we had put all around. And you can see that the whole graft had reinfected and the entire new cornea had melted. And all these structures from inside the eye have prolapsed outside. So you can see that how the COVID had affected the transplant efforts that we were doing, and how the patient, despite a transplant, got reinfected, could not present to us earlier on and lost this particular eye. So this is how, even after a transplant, remember that these patients have to come for regular checkups to rule out any recurrence of infection in their eye. And it's not just a one-time process. It's a commitment which has to happen even up to 1 year sometimes. So we monitor these patients initially weekly, then monthly, then 6 monthly, then yearly. What are the other causes of corneal blindness? So other than infection and trauma, the patient can be born with these kind of conditions where the cornea, this is a white lesion, like this is a macular dystrophy. This is a congenital hereditary endothelial dystrophy where the patient is born with literally the eyes look white in color. The cornea is not transparent, it is opacified. So in these cases, these are not infections, these have good prognosis. And if we give them a good corneal transplant, they will have very good vision. Again, a condition where there's ectasia. You said that one child, is having habit of eye rubbing, has an allergy condition. So the rubbing of the eyes is one of the main risk factors for developing a cornea which becomes shaped like a cone. This conical cornea is known as keratoconus, and this is a deformity of the cornea which causes decrease in vision. This will also benefit from corneal transplant. And this is again the cornea becoming white due to post-surgeries. Okay, it could be cataract surgery, it could be retinal surgery. So these patients can develop a corneal haze or a corneal edema, corneal swelling. These patients will also develop loss of transparency of the cornea. and a transplant will definitely change their lives forever. They will get very good vision. Now, if you see the national statistics, we told that we need 2,70,000 eyes to perform 1 lakh transplants per year in India. But do you know what is the statistics in India today? Between the years of 2023 to 2024, in India, there were 47,201 eye donations. And in that, the tissues which were actually eligible for transplantation and underwent transplantation to transform the lives was only 25,581. So you know that we need 1 lakh transplants per year, but only 25,000 transplants are being performed. This is a very large gap, and we need to understand why this is happening. So the same study which we had referred to, they said that the primary cause was a lack of awareness. People don't understand their social responsibility towards the people suffering from corneal blindness. They do not even know what is the psychosocial impact and the economic impact, and how a person after the corneal disease becomes immobile. That is, some patients may not be even able to cross the road, may not be even able to go from one room to another room if they are bilaterally blind. So their mobility is affected, their psychosocial impact. The only breadwinner, if he or she becomes cornea blind, then economic impact for the whole family, for the nation, in fact. These things are not known. Then comes the lack of awareness about the legal problems. Okay. So one thing is that in the West, in every driver's license, it will be shown that they are donor, that they want to donate or they don't want to donate. It is very explicit and clear. Whereas in India, even if you have pledged your eyes and you have said, I want to donate, if your family members choose not to permit to donate, finally your eyes will not be taken for eye donation retrieval. So these are certain legal hurdles that people don't know in India. Whereas in the West, even if the family members say that, no, we don't want this person to donate, irrespective of that, moment there's a road traffic accident or moment there is a death, if you have pledged your eyes or organs, they will immediately come and take it and go. There is no other way out in the West. But in India, we have these, objection of the family members is taken into consideration. Next, another thing is the illiteracy and people residing in rural areas. You know that most of India is in the rural areas, the population. So people residing in rural areas and illiteracy is another cause for lack of awareness regarding eye donation. And you know that the infections, what I showed you those pictures, they are all these farmers who have got some kind of injury from paddy husk or due to cow tail injury. So these patients can be affected by, this infection of the cornea, and they are more affected and require the transplant more than people in the urban areas. And also one more reason for the gap is fact versus fiction. There are many myths that plague eye donation. Let's tackle them one by one. First myth is, if I donate my eyes, the dead body will have some facial disfigurement. This is a wrong notion, because I showed you in that picture before, we only take the front part of the eye. We do not enucleate the entire eye unless and until we are going to harvest the sclera. So there is no question of facial disfigurement at all. Only the in situ technique is used and cornea is retrieved. Rest of the structures are sutured back and the eyelid is shut. So there is no question of facial disfigurement. Delay in funeral and other commitments related to religious beliefs, that will also not happen because the procedure is hardly 20 minutes. And it is done by specialized trained technicians, as well as postgraduate doctors and fellows in cornea. Next, people think that if we donate the eyes, the eye bank or the doctors will give it, they will sell it or give it to rich people, influential people for higher bid. let me tell you that each and every eye bank in India is under the HOTA certification, which is Human Organ Transplant Act certification. In this HOTA Act, we have to maintain a register, which is very strict about the sequence. In fact, I had one patient, one person who wanted to donate the eyes, but they put a clause on me and they said that only if you give my patient's eye to a Hindu, then only I will permit you to touch the eye and retrieve the eye. We told that patient, thank you very much, but we cannot choose who we will transplant the cornea to because we have a register. In that register, it will go as per sequence. So if a Muslim person is in sequence number 1 in the waiting list, it will go to that person only. It is as simple as that, because every month we have to submit our donor list and recipient list to the government. There is a state government and there is a national body which is monitoring the waiting list and the waiting list number. The only thing is the recipient will never be given the details of the donor and donor will never be given the recipient's details. This is illegal in India, but the government will know the details. Next, one more myth is, if I take the transplant from a donor eye who is having some disease in the eye, I will get that into my eye. This is again a very wrong notion. This is because, first of all, moment we take a cornea for transplant purpose, it has to undergo quality check. Unless and until that cornea passes the quality check, which is ruling out infections, ruling out any inherent corneal problems and inherent cell count numbers, unless it passes through all these quality checks, it will never be transplantable. So if you see the first slide which I showed, we harvest double the number of corneas, but finally we only are able to transplant only half the number. This is because of this reason. Many corneas do not pass the quality check, which means they may not be able to give you vision after the transplant. So those corneas cannot be utilized. They will be utilized for research purpose or some other purpose, but not for the transplantation purposes. So donation is must. But once it goes through donation, it will go to quality check and no disease will be transmitted from the donor eye to the recipient. The next myth is, I have undergone LASIK surgery in my cornea, or I am wearing glasses since 20 years, or I am aged, or I have some diabetes, I have BP problem. Can I donate? This is a very common question which is asked. And the answer is yes, because from the age of 2 years to 100 years, anyone can donate their eyes. There is no need of blood group matching, etc., because cornea is a avascular structure. So we don't generally do blood group matching like other organs. And any diseases of the cornea, such as if we've been wearing glasses, etc., it will not affect the result of the transplant. But yes, if you have undergone LASIK surgery, you can still donate your cornea. The inner layers of the cornea will be utilized for transplantation. This I want to make it clear. This is because cornea has 5 layers. The front layers and the back layers have different function. So in the LASIK surgery, generally the front layers have been cut open for the LASIK surgery. So even then we can use the back layers of the cornea to give vision to the patient. So this is called as partial lamellar keratoplasty. So remember that no amount of diabetes, hypertension or anything will affect the results of the corneal transplant, because it will go through quality check and we will select the best tissue out of your tissue and utilize that part for the corneal transplant. Next myth is, only those who pledge during life can donate after death. Nothing like that. As I mentioned, we have had cases where they have pledged their eyes, but the children, they have come from US or a foreign country and they have said, sorry, we don't want to permit, we don't want to go through with the donation, and we have had to respect that wish of the family members. So even though the person had pledged the eyes, the family members did not give permission. We've had situations like that. And we've also had situations where patient has forgotten to pledge We had a student here in MIT who died of drowning. He had not pledged his eyes, but his parents wanted to donate the eyes of the child, of the young man. So we have accepted that. So both ways it is possible. Whether you have pledged your eyes or not pledged your eyes, it is immaterial, because finally it is the family members' consent which matters in India as per the legal norms. Now, one more myth is, doctor won't save your life if you pledge your eyes or if you say, I want to donate. Now, this is the biggest myth which I want to bust your myth, because first of all, the doctor's job is to save the life. And only in cases where the life is not saved and only after death can we retrieve the corneas. So while the person is living, we had a situation where the mother came and told, my child is blind, give my cornea to the child. So we had to refuse, because unlike solid organ or kidney donation, eye donation cannot be accepted while the donor is alive. Only after death we can accept the corneal donation. So this is again the myth. I would like to bust this myth. So moral of the story, who can donate? Remember, anyone and everyone can donate from the age of 2 years to 100 years. When to donate? It is only after death, generally within 12 hours of death. Ideally, it is 6 to 8 hours, but even up to 12 hours, if the cornea if the eyelids have been shut and the body is kept in a cool place, such as the AC environment, even up to 12 hours after death, we can accept the donation. How to donate? Contact any eye bank, which is a multi-speciality hospital within an eye department in India. So for example, if you have pledged your eyes in Manipal to Kasturba Hospital Eye Bank, but you have expired in Delhi, there is no problem. You need not be thinking that I have to only, because I have pledged it to Kasturba Hospital Eye Bank in Manipal in Karnataka, I cannot give my eyes in Delhi. Nothing like that. Anywhere in India, even abroad, if you wish, you can donate your eyes anytime, anywhere. Just contact your nearest eye bank. So I just want to tell a few words about our eye bank, which is Kasturba Hospital Eye Bank. A small video. Is
Manali,
this audible?
voice is not coming.
Voice is not coming, is it?
आवाज नहीं आ रही है.
Okay, okay. Okay, I will just reshare it. Okay.
Dr. Manali, one question was that about why there is delay in taking the cornea. When
Why
they
there
call
is delay?
after death, yeah.
Uh-huh.
They're delaying. There is a question like that.
Well, first of all, it depends on where is the location. For example, if it is located more than 60 kilometers away, it will take time for them to reach that point. So please ensure that you give the correct location to the team. This is very important.
Actually, it is a responsibility of the family members to act fast. Does it? Hey, madam?
Yes,
Family
it is the
members should act very
responsibility.
fast.
Yes.
The responsibility of the family members to act, to take the action
Yes.
very fast.
Yes.
Manipal.
Is it audible?
Kasturba Hospital Eye Bank has been
Dr. Suleta, yeah.
transplant surgeries for the past 4 decades. It started with the under the leadership of Dr. P.N. Srinivas Rao, who is a renowned ophthalmologist in the coastal Karnataka and southern India. After him, Dr. K.R. Satish continued the legacy, and we were performing corneal transplant in Tulku. Then Dr. Vijaya Pai was the head of the department, and during that her tenure, our eye bank got the membership under the Eye Bank Association of India. Then, under the able leadership of Dr. Lavanya G. Rao and Dr. Krishna Rao A, in 2016, our eye bank was certified under HOTA.
The Kasturba Hospital Eye Bank is a SightLife accredited eye bank, and we also have the HOTA certificate to perform corneal transplantations. We have the latest state-of-the-art technology in equipments in our eye bank, such as the Conan specular microscope, the laminar hood flow, the CorneView for tissue evaluation, and the Cornisol media for tissue storage. The Kasturba Hospital Eye Bank performs the following functions. We do tissue harvesting, we evaluate the tissue, we preserve the tissue, we distribute the tissue and create public awareness, and in addition, we utilize tissues for research and training purposes. We procure, process and distribute corneal tissues of the highest quality for transplantation. We perform the aseptic measures and take care in making sure that we provide the best tissues for the best vision for our patients. We also provide and process eye tissues for glaucoma procedures, for research purposes and training of students. The Kasturba Hospital Eye Bank is one of the 2 SightLife accredited eye banks in Karnataka. We serve the whole of coastal Karnataka. We have a 24/7 hotline number, which is 9686692584, on which you can call to pledge and to donate your eyes. We conduct several public awareness activities, one of which is the Manipal Marathon, which was themed around organ donation. The general functioning guidelines is now changed because of the COVID situation. We are receiving, unfortunately, lesser number of donor cases. We collect the nasal swab from the deceased donor for RT-PCR COVID testing so that our recipients are safe from any kind of transmission of COVID-19. There are many contraindications for eye donation, but please remember, anyone can donate. But in order to make sure that the tissue is of the highest grade and our recipients benefit and get good vision, we tend to exclude a few infections, malignancies, and intrinsic eye diseases. The eye banking activities are not restricted only to corneal tissues. We also have our research collaborations with the University of New South Wales and University of Melbourne, and we are performing certain studies which help in the prevention of corneal blindness. On the occasion of National Eye Donation Fortnight, I'd like to leave you with one statement. Don't just leave a will, leave a vision. Even after you're gone, your eyes can keep seeing. So this is just to tell you about the functions of our eye bank. And like I said, we've had patients who are HIV positive also who wanted to donate, and we have respected their wishes, and we have even taken their eyes. In fact, we have taken the whole globe in those cases because they are used for research purpose. But generally, we do not take the entire eyeball, we only take the front part. Now, a small note about organ donation. So you have heard about kidney donation, heart valve donation, bone donation, skin donation, and of course, eye donation. But yes, remember that eyes and skin are taken only after death, but liver, blood and kidney and heart valves, these are all taken after the death. So first, what happens here is we identify the patient if they are brain dead, discuss with the consultant about the prognosis and confirm the brain death, and then it is passed on, the message is passed on to these sectors. So first is the anesthesiologist, for the OT booking, the neurosurgeon, nephrologist, pathologist, dermatology, ophthalmology, critical care, urology, and forensic. This is the entire team of organ donation. This is the entire organ donation team that we have. Now, for solid organs such as liver, heart, kidney, we do need to do the cross matching of the blood because these are all vascular tissues. So in the ICU, they will do the work such as the sample collection for cross matching and prepare the death intimation letter once the patient stops breathing and the support, the ventilator support is removed. In the OT, all the sterile and unsterile ice, custodial fluid, everything, the sterility of the OT is maintained to harvest the tissues. Also, we arrange for the police clearance and a green corridor where the ambulance will immediately, for example, if the kidney is harvested in Manipal, but the person who is in the waiting list number 1 is located in Bangalore, we have a green corridor wherein the ambulance will immediately take the kidney to the flight, to the airport in Bangalore or helicopter, and they will immediately heli-lift that a particular organ to Bangalore. So that is the importance of the waiting list. Waiting list number is most important. And also the cross-matching of the blood. So the blood grouping cross-matching should match that person and it will go to immediately in the whoever is first waiting list, it will go to that person. So even though the kidney was in KMC, Manipal, even though if we do not have a patient from Manipal, we will not wait for the patient to be from Manipal. We will only see the waiting list number of the patient. That patient can be anywhere. That can be in Mangalore, that patient can be in Bangalore, that patient can be in Belgaum also. So immediately it will go to that patient only, irrespective of where the kidney has come from. So this you have to remember. The consent, the release, the recipient list, we have to release the recipient list every time to the government. Every month, in fact, we are sending our statistics to the government and they are closely monitoring. So we cannot jump the list and say, okay, there is this kidney black market. People think, okay, I will give 10 lakh, 20 lakh. You put me first in the list. This is all hoax and it does not happen in standard hospitals. Invite the kidney recipient and send them the pathology and cross matching. So whoever is the next waiting list person waiting for the kidney, his cross matching of the blood is done. And then each organ is retrieved one by one. Cornea and skin are retrieved last after the death. And finally, the body goes to the forensic for postmortem, MLC, and then the death certificate is given and handed over to the patient party. So we learned about eye donation and organ donation. So what is the importance of telling you about this? How can you help? First of all, we request you all to join this cause and spread awareness in the community. Make the donation a ritual in your community or a family tradition. For example, if you have pledged your eyes, then you have to inform your children and your near and dear ones and your spouse that I have donated, I have pledged. So please honor my pledge at the time of my death. And yes, we know that August 25th to September 8th is eye donation fortnight, which is celebrated at a national level in our country. And let's make it into a social media campaign where you can, tweet about it. You can put Facebook images about it. You can put Instagram pictures saying that I have pledged my eyes, so that your friends, your community members will come to know about it, that they will say that, oh, he or she has pledged. Why not I do the same? So the social media campaign, and even in WhatsApp, you can share to your groups. You may be having WhatsApp groups among the senior citizen WhatsApp group. You can share that, hello, I have pledged all my organs. So you can tell that. And I have pledged all my organs and I have made it known to my children. Both my children, one is 12 years, one is 10 years old. Both of them know about it now itself. And I have made it known to my entire family, my husband, that I have pledged all my organs. Because not just your organs, even each and every thought that I want to pledge my eyes or my skin or my organs, it can change another person's life. And this year we are celebrating the 39th National Eye Donation Fortnight, where we want to tell each and everyone that the gift of vision is nothing short of gifting a life. Thank you very much.
Doctor, 1 second. Doctor?
Yes, ma'am.
Yeah, that sustained drops I had stopped some time back. So can you start again?
Ma'am, sorry. Which
Sustained
one?
drops. No, sustained drops, na. So can I start again? I had stopped.
When
it
did you
sometime.
open that bottle?
Recently, maybe 2-3 weeks back.
Yeah, ma'am. You can start, no problem. Whenever you feel irritation, see, the beauty of sustain is that it's not like an antibiotic course. I have to use in morning 6 o'clock, afternoon 1 o'clock, night. It's not like that. Any time you feel some irritation, something, you can just put the drop.
Thanks a lot. Thanks a lot.
Thank you, ma'am. Welcome.
QLED.
Fantastic speech, doctor. Fantastic
Thank you.
speech. Very
Thank
nice.
you.
Very nice.
Any
Thank
ask
you.
question?
Uh,
Any
uh,
questions?
yeah, QLED TV, what setting I should do, please tell me.
Or there will
for-
be, ma'am, in the settings, it will be written, ma'am.
What it is, blue light, what it is?
Blue light filter, then less glare. There will be different, there will be vivid setting, there will be different settings are there. Vivid means colors will become very bright.
Thank you, sir.
You can choose whichever setting and you can see, the picture quality, you can see whichever suits you, you can choose that.
Actually, doctor, as I don't have any central vision loss almost now, so I don't watch TV at all. Very less. I make
That's
it a
good,
point not to
ma'am.
watch.
Okay.
Because strain on the eyes, I feel. I
Yes.
can use it for a more good purpose than using on
Yes.
TV. I
Dr.
feel it
Manali,
like that.
she is Samata madam, Dr. Sengupta's Mrs.
Okay.
Oh, thank you very much, Padma, for
Thank you.
introducing me.
Yeah. And Dr. Sengupta ji, क्या करें?